because we're just recognizing what this actually is.
Growing up, Grace Hamilton knew something was off. Her period was never consistent.
At 11, they told me, like, oh, your cycle will regulate, and it never did.
Then came
So
mood swings and
it
hair
just was
loss.
like right on.
And despite being very active, Grace couldn't lose weight. Research told her what doctors couldn't.
I'm telling you, it's PCOS. Like, I've Googled it. I look like all these people in the pictures. I have all of these things. And they're like, yeah, but you don't have cysts on your ovaries, so you can't have PCOS.
PCOS, or polycystic ovary syndrome, a diagnosis Grace finally got more than a decade later after finding a provider who knew what to look for.
Yeah, it was just very, very clear that it was a metabolic missing piece.
This is the beginning and the first step of really changing all aspects for this condition.
Dr. Melanie Cree is a pediatric endocrinologist at CU Anschutz who says lots of doctors have missed this diagnosis. Cree is part of a group of experts who published a paper in The Lancet recognizing a new name for this common syndrome. What was PCOS is now PMOS, polyendocrine metabolic ovarian syndrome, a new name to help doctors better identify issues to look for, like weirdly timed or missing periods, but also high testosterone, ovarian egg issues, weight gain, and more.
So because of the name, patients are only thinking that it's a reproductive disorder. They don't realize that the weight gain, the diabetes, snoring, high cholesterol, high blood pressure, extra fat in the liver, those all go with PMOS.
For Grace, having the right name and diagnosis led to the right treatments, helping her lose weight, grow her hair back, and regulate her cycle. A small change, making a world of difference.
I've just been smiling for like almost a week now. I'm like, oh yeah, like it's it, because this is how that criteria that counted me out goes away. Like, this is where 11-year-old Grace gets a diagnosis when she's 11.
For the next 3 years, Cree says she's working on educating medical experts around the world about PMOS in hopes of helping doctors better recognize the symptoms and better treat women. She hopes the new name will help doctors sit up and pay attention. And for women, she says if you're feeling dismissed or unheard by your doctors, it is okay to get a second opinion or to circle back with your doctor to make sure you've been tested for everything associated with PMOS. Rachel Krause, 9 News.
I feel like even women in my life, Rachel, in the last several years have started to ask more questions about this specific situation. Yeah. The idea of this conversation is changing in a lot of doctors' offices already.
Yeah, absolutely. I feel like doctors are sitting up and taking notice, and women are feeling a lot more comfortable talking to doctors and saying, hey, something's not right. We have got to do more tests.
Okay, Rachel Krause, thank you.